Hello, it's Dr. Elizabeth Alter. So, have you tried our Sweet Shield? I'm sorry, it's backwards. So Sweet Shield is a very special supplement. Now, I've had other versions of Sweet Shield, but currently, and the one that I'm most excited about is, so as the name implies, Sweet Shield is your shield from having too many sweets. Also better sugar control. So as we know, glucose or blood sugar is the source of all medical evil. So everything that inflames us starts off with a blood sugar problem. And a lot of times I've had products before that help your insulin work better and things like this. But the truth is that what's going to change your sugar, and if you're trying to lose weight, if you're trying to be less inflamed, more alkaline, whatever it is less food consumption. So, you know, and I joke with my patients and I say the zipper. You gotta zip it up and not eat so much. Because again, we have such easy access to food, and unfortunately bad food at times, that it's very easy to get caught up and overeat, eat the wrong things. So Sweet Shield, I'm going to explain it a little bit, is basically a plant-based alternative that increases GLP-1. So it's an alternative, basically, you know, if you're considering semaglutide, Ozempic, Mounjaro, not everybody likes to inject themselves. So, and not everybody is comfortable with the potential side effects of GLP-1 agonist, or these new drugs, semaglutide, etc. So it's a plant-based alternative to increasing GLP-1 without these injections. It stabilizes blood sugar and it decreases ghrelin levels. So everything in our body is hormone driven. So insulin, this ghrelin, which isn't talked about so much, but what happens when we decrease ghrelin levels is that then you control your cravings. And I always remind patients that weight loss is a side effect of getting healthier, but you do see weight loss because, again, you're controlling your consumption of food, especially the carbs. So it's important for that. So you do 1 to 2 capsules 15 minutes before each meal, and just let Sweet Shield do its thing. And I find it very effective. Sometimes I forget and I take it too close to the food, and then it kicks in later. So this 15-minute window is important. Sometimes I just take one first thing in the morning, especially if you're doing intermittent fasting. That way you're not so hungry at the time of your meal. But it's definitely something to try with its lemon verbena and hibiscus flower extract. Those are the plant-based herbs that help mimic this or increase the GLP-1 production. So I hope you try out Sweet Shield and have a healthy day.